This medication, Kaopectate, is used to treat occasional constipation. It is often used when straining to have a bowel movement should be avoided, such as after a heart attack or surgery. Kaopectate is a stool softener that works by increasing the amount of water the stool absorbs in the gut, making the stool softer and easier to pass. Relief is usually seen in 1 to 3 days with this medication. It is important to check the ingredients on the label, as the manufacturer may have changed them. Also, products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. The recommended daily dosage and the optimal timing for taking Kaopectate should be determined by consulting with a healthcare professional. When taking Kaopectate, be sure to carefully follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Take Kaopectate by mouth, usually at bedtime with a full glass of water or juice, or as directed by your doctor. The dosage is based on your medical condition, age, and response to treatment. If you are using the liquid form of this medication, measure the dose carefully using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. If you are using the drops, measure the medication with the dropper provided, or use a dose measuring spoon or device to make sure you have the correct dose. Use Kaopectate only when needed. Do not use this product for more than 1 week unless directed by your doctor. Do not increase your dose or take this drug more often or for longer than directed. Your condition will not improve any faster, and your risk of side effects will increase. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. If you experience stomach pain, diarrhea, or cramping, or if your throat feels irritated after taking Kaopectate, you should talk to your doctor or pharmacist. However, many people using this medication do not have serious side effects. If your doctor has prescribed Kaopectate for you, they have determined that the benefits of the medication outweigh the potential side effects. It's important to follow your doctor's instructions for taking this medication. Contact your doctor immediately if you experience any serious side effects, such as rectal bleeding. While a serious allergic reaction to Kaopectate is rare, seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. As for the best time to take Kaopectate, follow your doctor's recommendations and the instructions on the medication label. If you have any concerns about the medication, don't hesitate to talk to your healthcare provider. Before taking Kaopectate, it's important to inform your doctor or pharmacist about any allergies you may have. This product may contain ingredients that could cause allergic reactions or other issues, so it's best to discuss this with your pharmacist. If you have severe abdominal pain, nausea, vomiting, or a sudden change in bowel habits over the previous 2 weeks, it's important to consult your doctor or pharmacist before using this medication. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor before using this medication, as the effects on pregnancy are not fully known. It's also important to consult your doctor before using Kaopectate if you are breastfeeding, as it is unknown if this medication passes into breast milk. The recommended daily dosage of Kaopectate for adults and children over 12 years old is 2 tablespoons, 30 milliliters, every 30 to 60 minutes, not exceeding 16 doses in 24 hours. The optimal timing to take Kaopectate is when you first experience diarrhea or an upset stomach. Remember to follow the dosage instructions on the package or as directed by your doctor. When taking Kaopectate, it's important to be aware of potential drug interactions. Certain medications may interact with Kaopectate, affecting how it works or increasing the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Never start, stop, or change the dosage of any medications without your doctor's approval. One product that may interact with Kaopectate is mineral oil. Always consult with your healthcare professional before taking Kaopectate if you are using mineral oil or any other medications. If you or someone else has taken too much kaopectate and is experiencing severe symptoms like fainting or difficulty breathing, it's crucial to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. It is important not to share kaopectate with others. It is also important to keep all medical and lab appointments while taking this medication. To prevent constipation, it is recommended to eat dietary fiber, drink enough water, and exercise regularly. Kaopectate should only be used for temporary relief of constipation and should not be taken for a long period of time to prevent dependency on laxatives. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. It's important to store kaopectate at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. Do not flush kaopectate down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.